Dear colleague, welcome. This is Dr. Jack, and I want to share with you my vision for the Child and Adolescent Master Psych Conference, or the CAMP Conference as we call it for short. Now, we held this conference for 4 years, and then we stopped around 3 years ago. And as we've been brainstorming over these recent months about how best to bring it back, I realized we cannot go back to the same old. And the reason is this. You've probably read that around 50% of clinicians experience burnout. They endorse it on surveys. Now, among the 50% of us who are not burnt out, we still deal with a lot of challenges and stresses and frustrations at work. So I was thinking, how do we come up with a conference that can help every clinician thrive? And so I came up with this 5-level model, what I call the 5 to Thrive. And looking at the top of our pyramid, we of course start with the psychiatric disorders. So yes, we have presentations that are based on psychiatric disorders like MDD and DMDD and ODD and ASD and ADHD and so forth. And then we have to cover the treatments that are available. So we want to cover any new medications, any new indications, any new precautions, any new studies or meta-analyses that may shed light on existing medications, other somatic treatments, and psychosocial treatments. So that is crucial information we need to go into detail into. But that's not sufficient, because probably the source of your main challenges at work are not choosing medication A over medication B or test 1 over test 2. They probably have to do with looking at the patient holistically and the family unit holistically. How many times have you had parents in your office yelling at each other, and heaven forbid they're undergoing a divorce, probably the volume is up to an 11? Or what if they're divorced parents and they have joint medical decision making, and one parent wants one thing and another wants another thing? Sometimes the most functional member of the family is the patient. So we do have to look at the second level of the pyramid and look at the patient and the family unit holistically. Next, we want to look at the clinic procedures, because many of the challenges we have in treating patients are predictable. Some patients will not show up for their visits, or they won't pay for them, or they won't adhere to treatment, or the patient or family are going to act out in some way. So the important thing is to set up the expectations for that clinician, patient, and family relationship right from the get-go. So we're going to cover, like, what should your websites say? What should your receptionist say when a patient or family member calls in to schedule an appointment? What should your treatment agreement state? So all of these can really help establish your relationship so that those challenges have already been addressed even before they arise. The next level of our pyramid is looking at the clinician's career over time, because the job that you have now is unlikely to be the job that you have 1 year from now or 5 years or 10 years from now. So we want to cover the options that are open to clinicians so that you can set up your career in a way that will most align to your values, to the type of patients you want to treat, the settings you want to work in, so that it is a unique career to you. And then the foundation of our pyramid is the clinician well-being. So we have these experiential training sessions where we do yoga and we do guided imagery that you can then perhaps explore if you haven't yet, and perhaps implement them into your life going forward. So we certainly have excellent faculty members for this conference, and they're going to add a lot. We're going to learn a lot from them. But they're not the only ones who are contributing. I think that we all together, as we come together as a community, we'll learn from each other, we'll inspire each other, and maybe even after the conference we can work together to hold ourselves accountable to making some of these important changes that we really ought to make in our lives, so that as you go through in the months after the camp conference, you can really see some changes in your life that really you'll look back and say, yes, I really am thriving more than I was before I came. So I'm making bold promises that we're going to cover a lot of things and that I'm going to really help you, set you on a path to thrive. And of course, the camp conferences, all our products, they have a better than money back guarantee. So I'm really putting myself on the line. I really hope that you will join us. I would encourage you to read the rest of this website and really look into the details. We'll be at the Wild Dunes Resort on the Isle of Palms, which is around 25, 30 minutes outside of Charleston. It's in a beautiful setting, you know, an 8-mile or 10-mile long beach, and, you know, easy drive to Charleston if you want to then go after the day's activities to have dinner there when you're not together at the resort with your colleagues and perhaps family members or your significant other. So please take a look. I hope you decide to join us. This is Dr. Jack signing off. Thank you so much and take care.